That's an easy question to answer. If you walk down the street, if you look at a television program, how often do you see the people that are being interviewed, the actors or the actresses, with scars on their face? It's shocking in terms of the numbers. Scarring is common. Well, you know, there's a thought abroad that if you only have a few acne bumps, if they aren't really of major concern, it's a teenage problem, it's going to go away. The difficult consideration that we all have as dermatologists is all too often that superficial few acne lesions that we see can lead to scarring. You don't have to have moderate, severe, large, cystic lesions to create scarring. Well, I think there are two considerations here. One, if you think about acne and the process, I think the major consideration is what anatomic sites on the body. Is it just the face that's involved? If you take a look at the shoulders or the back or the chest and see lesions on these non-facial areas, it gives a very definite hint that they have severe acne, even though it's not being demonstrated at the moment on the face. The second tip-off, if the parents happen to be present at the consultation, or if you happen to see them accompanying the teenager, just take a quick look and see how the mother and the father, and whether they have facial scarring. And believe me, if you add those two together and you see the patient with acne on non-facial areas, and then you see the parent, mom or the dad, with remnants of acne scarring, it's a tip-off that you're dealing with something that's not completely benign. Well, that's a wonderful question for me to answer, because I happen to have been around in 1983 when a retinoid drug called ISOTRETINOIN, Accutane, first saw the light of day. And it was the opening chapter in something in dermatology that we had never had before. Within a matter of months, it became obvious that here we had a therapeutic tool that could take a problem that had faced us for generations, and suddenly, in 3 months, 4 months, change a patient's life. Not only in what happened at the time, but a continuation, a robust kind of improvement that could go on for years following the treatment. So, to me, the hammer is isotretinoin. Well, one of the brightest chapters that we can now report is that in the past 48 months, we've had a new generation of isotretinoin become available for us, and this drug is called Epurus, and fortunately it's available in multiple dosage forms, 10, 20, 30, and 40 milligram. So it makes the dosing very easy, but the real advance has been it is so formulated that it takes into account The difficulty that we've always had with isotretinoin, it makes it much easier to be absorbed. And dealing with teenagers who are not too compliant, and when you suggest eating a fatty diet, it isn't the first thing that makes them happy. But with the purists, the matter of solubility and fat intake becomes less of a necessity in order to get the absorption that's needed to get the therapeutic benefit. So in two ways you get improvement. You don't have to eat the fatty diet, and number two, you get better absorption of what you do take in, and that in the end ends up with a better therapeutic result, fewer pimples, and saving money.